The number of COVID-19 cases continues to rise globally and right here in Guyana. Therefore, we encourage everyone to practice social distancing. Wear a mask if you have to leave your homes and wash your hands thoroughly and frequently as we all strive to stop the spread of the virus. Welcome to InfoHub for Wednesday, July 8th. Thanks for joining us. With a rapid spike in coronaviruses, here the Public Health Ministry continues to reiterate the importance of adhering to all precautionary measures to prevent further spread of the deadly disease. Kellan Rover has our first story.
Fellow Guyanese, I wish to allude to the irresponsible actions by our citizens in Region 9, whose intent was to transport Brazilian nationals to Georgetown, ignorant of their COVID status and cognizant that the COVID-19 situation in Brazil is out of control. In fact, as of today, Brazil has 1.63 million confirmed cases and 65,631 deaths. Friends, this is just across our closed border. I ask these questions. Is money all that matters? What about your life?
Deputy Chief Medical Officer Dr. Karen Gordon-Boyle. She said the number of positive cases is of grave concern for the Ministry of Public Health. Over the past week, the ministry has recorded some 25 new cases distributed in regions 1, 3, 4, and 7 with 4 COVID-related deaths.
I shared with you last week the traumatic experience of a COVID-19 patient, as well as the unpredictable future of persons who have thankfully recovered but may be subject to medical conditions of kidney failure, lung damage, paralysis, among others, that they did not have before contracting the coronavirus disease. Are we really serious about returning to normalcy when we openly flout all the guidelines that have been outlined for our protection? Are we saying that we are uncaring about our life and those of others around us? Where has our appreciation for life disappeared to? It is unfair to our healthcare workers, 10 of whom have become ill and have had to battle for their lives with COVID-19. And you know what this was totally unnecessary, but for your carelessness.
The Deputy Chief Medical Officer reminded that once the virus is contracted, one's life can drastically change.
I wish to refer to the unfortunate situation that occurred with the passing of our latest COVID-19 victim, whereby the information was aired on radio before the health officials were even able to notify the family. I implore members of the media to be sensitive to the fact that when there is a death, the family experiences pain and loss, and that such information needs to come from health officials who can impart the news to the family in an empathetic and caring manner. Imagine the shock of you turning on the radio or TV only to hear for the first time of your mom's demise from COVID-19, and no one is there to support you in dealing with it.
The importance of adhering to the COVID-19 restrictions by the public health sector cannot be overemphasized.
My fellow Guyanese, we may not be given that second chance. And remember, your carelessness could unnecessarily put our healthcare workers' lives at risk. Do your part. Respect the curfew. Wear a mask. Practice physical distancing. Wash your hands frequently and only venture out if absolutely necessary.
For InfoHub, I am Kellan Rover.
Meanwhile, a COVID-19 screening and testing unit has been established at Buck Hall in the Essequibo Islands near Carrier. Buck Hall is said to be the main access point to several mining areas, including Aranco, which has reported a large number of COVID-19 cases over the past few weeks. Delicia Haynes tells us more.
The unit was set up directly at the entrance of Buck Hall, and it is here anyone passing to leave or enter must subject themselves to mandatory screening. Any person presented with signs or symptoms of COVID-19 is immediately quarantined, then transferred to an official quarantine facility on the west coast of Demerara until their COVID-19 status is verified. Regional Health Officer Dr. Serda Makwat gives further details.
This area has been traversed by many miners, a total of 60 persons traversed daily. That's why it's an area of interest whereby we want to have a checkpoint setup / a testing facility. Most of these persons will access, or through Bokal will access, the interior location of Aranca and other areas, and from there they can either go to region number 2, Supanam, or proceed to region number 3, Parika. Hence, this activity was.
Buckhall has recorded one COVID-19 case, and since then, residents of Karya have been on high alert, while those in the transit community are continually being urged to do all that is necessary to protect themselves from exposure. Health worker at the Karya Health Center explains.
Persons from Karya used to work at Buckhall, but because of this COVID, the most persons refrain from work, so hardly anybody comes and go to Karya. The only time when here would be a person from Karya is like myself when I'm doing visit, and like house to house finding out and encouraging people to continue with the social distancing and using the mask and the sanitizer.
6 volunteers were trained to support the operation of the screening and testing unit. One of the 6 volunteers who was trained, Anastasia Class Patterson, noted that she is eager to play her part in ensuring that the spread of COVID-19 is not as rampant in the area she lives.
It's one of the first steps in many to take to help battle this COVID-19. I don't want to see anybody I know die from carelessness and all of that. So if I can just tell one person to stay away from that person and it saves their life, well, I'm happy to do that.
The unit, which has been set up by a volunteer group from the Civil Defense Commission, is one of the prefabricated houses which were donated by the United Nations High Commissioner for Refugees. For InfoHub, Delicia Haynes.
Early today, residents along the coast experienced severe winds and heavy rains. This resulted in the roofs of some homes being blown off. The Civil Defense Commission has dispatched damage assessment teams to several areas. The Commission is urging residents in communities that are prone to flooding to be alert for the weather conditions and take all necessary precautions. Citizens are encouraged to report any emergency situation to the CDC's 24-hour National Emergency Monitoring System on 623-1700, 600-7500, or 226-1114. The Finance Ministry has distanced itself from an article published by the Guyana Times newspaper which claims that the government appropriated money budgeted to service debts for mysterious purposes. Here's more from Alexis Rodney.
The misleading article appeared in the paper's July 7th edition. The ministry has placed on record that there are 2 categories of public expenditure: appropriated expenditure and statutory expenditure. Appropriated expenditure requires approval by Parliament and must be embodied in an act, while statutory expenditure, such as debt service payments, is a direct charge on the consolidated fund and does not require parliamentary approval. The ministry said that there is nothing in the 2019 end-of-year outcome report that could have reasonably led to the confusion and conclusion that the savings from lower external debt service payments in 2019 were appropriated or moved to other items of government expenditure. The statement from the ministry pointed out that it is customary for projections to be made for debt service payments to the non-Paris Club creditors in arrears, in the case Guyana is able to successfully negotiate, finalize, and sign debt settlement agreements with those creditors. This practice, it stated, is in line with sound financial management. It is therefore obvious that there will be savings on the external side if no debt settlement arrangements are finalized with creditors within the budget year. The ministry said savings from statutory expenditure cannot simply be reallocated to other non-statutory uses without parliamentary approval. The ministry strongly denounces all instances where facts are deliberately distorted to advance narrow agendas and narratives. It said such unethical practices only serve to cause unnecessary disquiet among the general public and diminishes national standards of journalism. It said readers deserve better. For InfoHub, Alexis Rodney.
More news after this short break. Stay with us.
The COVID-19 pandemic has had a devastating effect on communities all across Guyana. Many households and individuals now find themselves in need of public assistance. The government of Guyana will be assisting the most vulnerable. Those eligible to apply for this assistance are as follows. Individuals and/or households who are currently benefiting from public assistance provided by the Ministry of Social Protection. Individuals and/or households who applied for public assistance and are awaiting a response from the Ministry of Social Protection. Individuals and/or households who suffered a loss of income due to COVID-19, and households headed by senior citizens or persons with disabilities. Application forms can be downloaded from the Ministry of Social Protection's website at www.mosp.gov.gy or government.gy/eform/241. For further information, please call these numbers. We are in this together. This is a message from the Government of Guyana. We are here to serve you.
Londoners and other stakeholders benefited from a virtual consultation held on Tuesday for the construction of the new Wismar Bridge. Stacey Carmichael tells us more.
Hosted by the Ministry of Public Infrastructure, the engagement provided Londoners an opportunity to hear from the Italy-based consultant, Polytechnica, and technical officials attached to the ministry. During the virtual presentation, Polytechnica's team leader, Francisco Reina, displayed the proposed design for the bridge. Responsible for spearheading the feasibility study and designs, Reina said 4 bridge designs were considered. These included a half-through arch bridge, composite steel concrete girder bridge, modular girder bridge, and a precast concrete girder bridge. Participants of the Zoom meeting were informed the latter design is preferred due to its structure and materials that are to be used for construction. The preliminary design includes the new Wismar Bridge on the southern end of the existing Wismar Bridge. It will accommodate 2 lanes for vehicular traffic, 2 shoulders on both sides, and a footpath on one side of the bridge. The new bridge will also be outfitted with street lights. Fielding questions from residents, Chief Transport Planning Officer within the ministry, Patrick Thompson, said the future uses of the old bridge have not been finalized as there are options on the table for it to facilitate non-vehicular traffic. Another concern brought to the fore was a sharp turn on the Mackenzie approach of the bridge. To this, residents were told the design of the bridge was done within the boundaries, state land, and any design outside of that boundary would encroach on private property. The new Wismar Bridge will cater for the continued expansion of Linden, in particular the birth of the Linden-Lethem Road. For InfoHub, Stacey Carmichael.
Remember to do your part to ensure that you do not put yourself at risk during this time. If you have a cough, fever, or difficulty breathing, please seek medical care early, but call those Corona hotline numbers first. That's all for today. Connect with us on our social media platforms, including WhatsApp, Facebook, YouTube, or Instagram, as we bring you the latest and important news related to COVID-19 and much more. You can also subscribe to our website, dpi.gov.gy. Your Bridge Report is up next. Goodbye for now.